Hello, I'm Dr. Eric Cornelius. I practice holistic dentistry in San Antonio, Texas. I had somebody ask specifically for a conversation about fluoride. So, fluoride in dentistry is generally advised and recommended or prescribed for all sorts of things, specifically for cavity prevention, remineralization, desensitization, and it does function for those well. So why in a holistic dental situation would we not talk about using fluoride or even talk about not using fluoride? And the reason behind that really has to do what you're perceiving as your sphere of influence or your sphere of control. And if it's just the mouth, just the teeth, fluoride is where you stop. Fluoride is the best thing that you're going to have and the best thing that you can use. However, if you care about everything, the whole body, kind of by definition holistic, then you're going to be looking at the entire body. And if you do that, then the question starts to come into with fluoride. Fluoride binds to the thyroid with more adhesion than iodine does. So if instead we're thinking from a holistic point of view, as in the whole body, then we have to think a lot more than just about the teeth. And as soon as we do that, then we have to ask other questions about fluoride. So fluoride is a neurotoxin. At what concentration is still highly debated and depends on what side of the fence people fall on, but it is a neurotoxin. We don't really want that wandering around in the bloodstream or in the brain. And so we want to minimize that effect of it. Secondarily, fluoride binds to the thyroid with a higher adhesion than iodine does. So again, if you're thinking about the whole body, not just the mouth, then fluoride becomes less than our perfect choice. So if we're thinking of the whole body holistically, as the name implies, the entire body, then we have to look at fluoride differently. So fluoride binds to the thyroid with a stronger adhesion than iodine does. So if we want thyroid health, then we don't want fluoride around. As well, fluoride is a neurotoxin. What concentration causes neurotoxicity? That is something that is hotly debated and strongly disagreed upon, depending on which side of the fence you align yourself with. But either way we look at it, if it is and does have neurotoxic effects and does have a binding effect on the thyroid, then our question comes into holistically, not just the teeth, but holistically, it's not our best choice. So then we ask the question, if we're trying to do cavity prevention, we're trying to remineralize small cavities, or we're trying to prevent sensitivity, what other options do we have? There's really two answers to that. One is going to be diet, and the other is going to be hydroxyapatite. So hydroxyapatite will remineralize, and it can prevent sensitivity. And so that is an option that we can get in a mouth rinse or in a toothpaste. The second one, which truly, if we're talking holistically, is probably the most powerful, and that is diet. And we remove the factors that cause cavities to start with. So if we start looking at a diet that is going to prevent cavities or keep us from getting cavities, there's some selective things we need to look at and we need to choose. One is no sugar. If we are adding sugar to our diet in any way, and that can be organic sugar, that can be fruit juice, that can be any of the above, then we are going to position ourselves to have cavities. So removing sugar, not consuming sugar, is the very first thing we need to do. And then secondarily would be fermentable carbohydrates, specifically simple fermentable carbohydrates. So that's going to be your crackers, your pastas, your simple carbs. that the body can turn into sugars very, very quickly and inside the mouth. Where this matters most, there's two levels to it. The first is there's only one bacteria that can cause cavities on our teeth, and that's Streptococcus mutans. Streptococcus mutans uses a sucrose molecule, plain white sugar. It uses that sucrose molecule. There's a high energy bond in the middle of it that it busts. When it breaks that high energy bond, it then takes that energy and uses it to glue itself to your tooth. Once it's glued to your tooth, it can then use all different types of sugars to make more acid to help it eat holes in the teeth. But it needs that sucrose right off the bat to get that energy to stick to the tooth. Historically, to look at this in kind of an interesting story, is Socrates came up with a philosophy of dental decay. They didn't call it cavities, they called it tooth maggots. But his belief was that the eggs for tooth maggots were carried in dates. And that's absolutely fascinating, because if you try and find something in the ancient world 2,500 years ago that carried enough sucrose to give you a cavity, that's really the only food that there was available, was dates. So, and this also answers a question that I get almost all the time, and that was, can you get cavities from fruit? Well, yes, you can. Dates is completely natural. It is a fruit from a tree, and yet you can still get cavities from it if you consume too many. So avoiding sugars is the primary method to prevent cavities.